things that go into this model that we think are important are, first of all, developmental outcomes. We're interested in certain aspects of children's development that if you don't hit a certain developmental milestone at a certain stage in your life, it's not the end of the world, but that child is going to feel that for the rest of their life. Some of us won't have hit all of our developmental outcomes when we were growing up, and we're feeling it now today. We're all functioning well, but it's a handicap that we've carried and dealt with through our life. And what we're about is trying to reduce those developmental impairments throughout child development. We'll be talking about some of those today. The second aspect of this model is that it's about public systems, and therefore it's about money. And the reason why we're interested in public systems is because every year, every day, your organisation, your areas are spending, the public systems, health, education, social care, police, youth justice, in your area are spending £5,000 per annum per child on children's development. And that money is becoming more limited, it's getting more squashed, and if we're going to improve outcomes for kids, we need to make that money work harder. We're very interested in this process. The lottery are very interested in this process. The experts, some of you will be here at the training event tomorrow, are interested in what they call system reform. And for us, the clearest indicator of system reform is that money spent by public systems is spent in a different way. So you're all here because you're thinking, bingo, the big lottery are going to hand out £50 million per site, 30 to £50 million per site. That to us is a little bit noisy. It's interesting, it's noisy. But unless we can use that money to shift the way in which you spend your money locally, we will not have made any progress. And if you're making bids to Big Lottery in December, unless you can show how the money that they will give you will shift how you spend your money locally, don't expect to be going through to the next round. And we'll talk a little bit more about that later on. The other aspect of this is an ethical question, which is we don't believe in our work and we've done this through long experience, we don't believe you can tell people what to do. You can tell people what to do, but on the whole, when you tell people what to do, they don't do it. It's a bit like your kids, yeah? My 17-year-old daughter was on the phone last night and I was telling her what to do. Bad parenting, it's not going to work. She's almost going to do the opposite because of what I'm telling her. There has to be other ways of doing it. You have to have a conversation. You have to engage with people. You have to bring people together. And that's the ethic that we have in this process. Bringing people together from public systems and communities, getting people involved in a conversation and getting them to come up with a collective strategy about how they will go about this work. There'll be lots of things that you disagree on, but we want to build strategies around the things that you agree on. And there's a lot that you can agree on in your local areas. If we're going to do that, we need to be able to think carefully about how we speak to each other. And the methodology that we inject into this is called common language. We have found through our work over the years that when you're working with a police officer, for example, and a teacher around the question of prevention, nobody's going to say prevention's a bad idea. Everybody's going to say prevention's a good idea. But they're going to have completely different ideas about what prevention is. And unless you get people talking to each other and not across each other, you're going to get a lot of confusion and lack of clarity. The final aspect of things that are really important in this is scale and quality of implementation. We've had a lot of success in our work at Dartington in helping governments, helping philanthropy, helping communities to implement evidence-based programs in particular that have had an absolutely clear impact on children's lives. We have, with the best scientific evidence, we know we've improved parenting, we've reduced conduct disorders, we have made children happier, we have done work that has improved educational outcomes for children. But where we've consistently failed, and where you have consistently failed, where most people in the world have consistently failed when they've done similar things, is that we haven't been able to do that at scale. And if we're going to make a difference in these 15 areas, we don't want to just reach a small proportion of children. We want to reach every child, and we want to make sure every child has some kind of intervention that will help them reach their developmental outcomes. And if we're going to do that, we have to pay attention to one of the big gaps, particularly in this country, generally across the world, which is implementation quality. We've had fantastic interventions put together in one place, and we've seen them delivered with really high quality, and we've seen them improve outcomes for children in quite remarkable ways, and we've seen exactly the same program that we've implemented in another place, and it's been implemented badly. And not only do we not get the same outcomes, in a couple of cases we have left children worse off than if we hadn't put that program in place in the first place. So if you don't implement well, you don't get a good outcome. We're going to be talking about that a little bit later on. What's different about the methodology we're putting in place? Well, one, it's a methodology. Most of these kind of programs that you would have been involved with, a big lottery, you know, you get the go-ahead to put an application in, and you'll be writing the bid today. We're asking you to be methodical about this, to appoint somebody locally who can coordinate the work, to create a governance structure, to collect data, to look at what works, to bring people together so you collectively come up with a vision, to write the strategy together. So you don't get together, come together, and then think, okay, let's hand it over to Harry, and Harry can write the strategy, and then somebody checks it afterwards. That you all sit down and write it together. That you have shared accountability for that strategy. So when it comes to implementation, again, you don't hand it over to another agency to deliver. You have a board that will come together in the governance structure, and Louise will talk that through in a moment, will remain responsible for this strategy for the next 10 years. The membership may change, the chief executive and the local authority may be on that board, but the chief executive will change for sure 2 or 3 times over, but the chief executive will always be on that board. The VCS lead may change on that board, but the VCS lead, there will always be a VCS lead there. There will always be community representation on that board. And the reason for that is retaining accountability for implementation makes a huge difference to outcomes. Say a few more things about the work. We're in this area of what in the world, this is becoming quite a growing movement of work in the world now, that's called place-based reform. And what we mean by place-based reform is, instead of doing work that focuses on, for example, a local authority area, or a CCG area, or it could be a ward, or 2 or 3 wards that you want to focus on, or a local community area. Instead of doing that, the administrative areas that determine much of the work which we do, we select areas where there is a commonality in the people that live in those areas. There's a commonality around need, or there's a commonality around aspiration, or there's a commonality around a sense of place to live, and then we focus on those areas. And we get the people from the boundaries, of course, are going to be a bit of a mess then. It's not going to fit with the school boundary exactly, it's not going to fit with CCG exactly, it's not going to fit with the local authority exactly. That's not the deal. The deal is the place is what matters. And then you bring people together from public systems to serve that place, and you bring them together with communities. That's what place-based reform is about, and it's about then putting together an investment strategy to help that place, testing it where it works, sharing those results with other people so they can benefit from your learning. It's about changing the relationship between public systems and local communities. It's a fundamental aspect of place-based reform. And the thing I want to stress about this is, why are we doing it? At Dartington we've done this 2 ways. We've worked in Ireland, where we primarily only worked in communities over a 4 or 5 year period. Local communities, getting engagement from local people, and not paying attention to the big public systems. And we made a lot of progress, but because we didn't get the systems folk involved at the outset, we could never get them engaged and get them to put their money in. In Birmingham, we did it in the opposite way. We've also done this in Renfrew, and we've got colleagues from Renfrew here today. We've done it in Perth and Kinross, where we've focused on the public systems first. And more or less ignore the community. Maybe that's not so important. Maybe you should just focus on the systems, they've got the money, concentrate on them. But if you don't get the community engagement, you don't get better outcomes. So we're not bringing groups together because it's nice to engage with communities, it's nice to have local people represented, it's nice to hear the voice of the user. We're doing that because all of the evidence that we have looked at from around the world, where you get shared accountability, and not just engagement, shared accountability between a community and a public system, you increase the magnitude of the outcome you achieve at the end by an effect size of 0.1. I better just explain what that means. I should have done that before I gave you the figure. So we measure everything in terms of effect size because it's a way of balancing out different kinds of outcomes. An effect size of 0.0, as my friend in Johns Hopkins University puts it, is nothing. No effect whatsoever. -1, you're making things a lot worse. And by the way, you're doing quite a lot of things that make things a lot worse. Let's put that to one side. It might be one thing you want to think about in your investment strategies. +1, you're doing things so well, we're beginning to think you've cooked the books and the results can't really add up. So 0.2, 0.3, 0.4, these are all really good effect sizes from any kind of intervention. And when you have, let's say you've got an intervention that develops an effect size of 0.3, bingo, hallelujah, we are happy people. If you also bring to bear on that work shared accountability between communities and public systems, you will boost that effect size by another 0.1. So we're doing it, not because it's nice, but because it's better for kids. Other aspects of this is that this work that we really care about is that it is about systematic change. And I can't emphasize this enough. We know from the work that Big Lottery are trying to do that there's a real danger here. There's going to be a lot of excitement over the next 2 or 3 years, significant investment in 3 to 5 sites, and then business will revert to normal. How many of you have been involved in initiatives like this where there's a lot of excitement for a short period of time and then the system just goes back to stasis, it goes back to equilibrium? We want to achieve systematic change in public systems. Systematic change in public systems, the easiest way for me to describe it is that instead of this being a sideline over here, the budget item on the local authority budget, on the CCG budget, the Director of Public Health's budget, actually changes systematically. Over the 10-year period, you're going to see line items that are dedicated to this work. Just as what a systematic change has been achieved in the last decade, Sure Start Children's Centres. You all have a line item for Sure Start Children's Centres. Some of you are trying to diminish that line item, but it's damn hard to diminish once it's there. But if you have something which is marginal and on the sidelines, it's very easy for people to forget it. And it's there for 2 or 3 years, but it's not there for the long term. We're looking for line items that will endure for the 10 years of this work. Another aspect of this work is that it's about prevention and early intervention. Maybe I don't need to sell that, but if we are going to make a difference to children's lives in the next decade, when public sector funding is going to continue to diminish. The Chancellor's going to do a speech today where he says, hallelujah, we're through the worst, everything's going to be rosy. But the other thing he's going to say in brackets that perhaps won't get as much coverage is, budgets will continue to be cut for the remainder of this decade. If that's going to happen, we're going to improve outcomes for children. There's only 2 options. One is to prevent problems happening before they start, and the other is to intervene early, right at the get-go, so they don't develop into expensive interventions later on. So it's fundamental to this work as we move forward. And the other aspect of the work is that it is both evidence-based and it's science-based. The science-based, why is that important? The science-based is about trying to help us to think about what we have learned from science over the last decade. And by the way, it has transformed, absolutely transformed. Some of you will be here tomorrow and you'll hear from Jack Shonkoff at Harvard University. Those of you who are not here will be able to see that on video. Some of you will have looked at some of the videos that I think are on our website, certainly on his website, about what we've learned about brain development over the last decade. This is changing radically the way in which we think about children. And we have to think differently about the ways in which we therefore intervene. Just to take one simple example, we know that there are huge drivers for what we call toxic stress. Toxic stress is when those risks in children's lives get under the skin and it begins to change the way in which the brain is wired. It begins to change the way in which the child behaves. It begins to change the way in which the child can engage with primary school. It begins to change the way in which the child relates to other people. It begins to explain why some children begin to bully, why some children can't concentrate in school. This is toxic stress, it's how it gets under the skin. And we know what the risks for that are. They're poverty, they're poor parenting, they're alcohol consumption during pregnancy, they're living in an environment where there's a lot of violence, they're domestic violence, it's child abuse. We know what the risks are. But many children exposed to those risks don't succumb to the risks. They don't develop the toxic stress. They develop perfectly normal. Many of you in this room will have experienced exactly that. But now what we can do, is that we can begin to mark that toxic stress. We can take blood samples from children and we can begin to identify those that really are at greatest risk. Now this is technology that's coming on stream, and over the next 10 years it's going to change the way we think about children. There's huge breakthroughs in the things that we understand about the interaction between genes and environment. So this science is going to transform the way in which we think about services, and we want to inject that science into your thinking as you innovate, as you develop ideas over the next 4 months and put your ideas together. And we want that science to be at the fulcrum of your work over the next 10 years, because we're not just designing things in the next 4 months, for the next, for the 10-year period. You're going to design for the next 4 years and then continue to develop after that. The evidence base is important. There aren't that many evidence-based programs in this area of conception to 3 years of age, but there are many incredible years. Most of you will be using Family Nurse Partnership. Most of you will not be using Family Nurse Partnership at scale. So these are questions you're going to have to ask yourself. Are there interventions that have proven impact on children's lives that you could make more use of in your areas? The science-based and the evidence-based is an element part. 2 more points to finish off. One is we are methodical about this. There is a 5-stage process. In the next few months, there are about first 3 stages. So we're now in the stage already, stage 1 of engage and commit. That's bringing people together, having the conversations, getting the right people to the table. If you want to get money moving, you better get the people who are going to have control over that money to the table. If you want community people behind it, you better be talking to people in communities about getting them engaged in the process. Bringing the right people to the table is where we are at the moment. Stage 2, we're just about to begin building the partnerships, collecting the data, collecting the wellbeing data, collecting the money data, checking on where your resources are at present. And then stage 3 will come in December. I know there's a lot of anxiety about this. We're trying to allay some of that anxiety today. But in December, that's the moment when you all come together as a group, each area, and you put your strategy together, and we have a methodology for doing it. Those of you that go to the next stage, and I'll talk to you about who I hope that will be in a moment, will then have 2 further stages. Stage 4, which is about design, implement, and plan. So that's about saying you have a broad strategy, but then you go down another level, and you have very detailed plans around each aspect of the overall strategy. And the lack of those plans explains why a lot of implementation goes awry, particularly in this country. And then stage 5 is continuous, which is about learn, adapt, and develop. Always taking in the data, adapting the strategy, taking the data that we were learning about wellbeing and implementation quality to change what we do. That all comes next year.